This is Software Meets Business, a podcast sponsored by Head Channel.
Welcome to an amazing episode of Software Meets Business. And today I've got with me Iskander Chaudhry, who is the CEO of PathHub Software. Hi, Iskander.
Hi, Richard. How are you?
Good. I'm really excited about talking to you today on the podcast because, as you know, this podcast is all about how business and software meet. And you've built a software business. And so in pathology, which is kind of quite a hard place to work. But so why don't you just kind of tell us a bit about your background and how all of this came about?
Yeah, I'd love to. Yeah, sure. So I'm a person who has two hats on. Mm-hmm. So I work in the clinical sector. So I've been a pathologist, as a consultant pathologist since 2005, working in a number of subspecialties within histopathology, and have been working with a number of trusts based in the Northwest, but also trained in London. I went through the regular training program as you do in the UK. And when I became a consultant, slight difference to my kind of drivers to other consultants is I built up a business portfolio as well. And I ran in parallel with my clinical work. I started work part-time, but had that ambition of driving some kind of business elements to my portfolio. And so I embarked on some businesses. And my initial business was within training and education, which is something I really love and something I still do.
Around pathology, right? Training education around pathology?
Yeah, some of it was kind of pre-medicine. So I would be offering training to youngsters, apprentices, people interested in going to medicine. And I did a number of specializations, but broadly speaking, I did medicine, but I also did veterinary, etc. And then undergraduate, and then I went into postgraduate. And my initial approach was actually to run it across histopathology, but also clinical. So I did ones in medicine, ones in surgery, etc. But in time, you build your business out, and I focused on histopathology. And now currently I run exam preparation courses for the Part 1, FRC Path, and I also run kind of update courses in histopathology, but around some specialties. So I might do something in skin or breast pathology, depending on, my kind of interest and people who I've spoken to in terms of what they want as well.
Great. And so as you started to put this business together, what kind of tools were you using to run the business? And when did that sort of start to turn into software that you yourself, were building?
Yeah, so kind of my life has kind of transitioned from, almost you go into a sector, you initially have a certain outlook. So when I first started, I had the ambition of building an online education platform. So I'd got a company based in Manchester to help me build that. So that was supposed to be quizzes, interactive website, etc.
Yeah.
And through their kind of customized CMS, I was able to build websites myself through the CMS. And I found that actually it was quite important for the courses I was running. A lot of the kind of keynote speakers or program directors wanted websites of their own. So I kind of started to learn through the CMS how to create sites. And then after that, I then started building my own knowledge of the area. So I did a little bit of coding, a little bit trying to get a bit more understanding around this area, but still used kind of third party. I just wanted to learn how the technology was working. Then my kind of main change in direction was when I got a contract through Virgin Care. I got a contract in pathology services, and they were looking for somebody to provide those services. And clearly I can do the pathology part, but they were also looking at service management and laboratories.
Right.
So I kind of moved away from purely education, started looking at pathology services, and through that had to then build new software. And really the software was to deal with a specific scenario.
Is that because you could?
Yeah, and in those days, there was definitely nothing off the shelf. Even now, if you were to Google kind of, histopathology software or SaaS products, you won't find them easily. And if you do, it's big corporations like, CoPath, Telepath, iSoft, etc. And these companies would do major installations in hospital settings, not for the small customer like ourselves, small CMEs. So in that period, and we're talking back now to 2015, it was the norm to be able to just generate your own. And it's very the initial concept is really quite basic. It's just a database input fields, and then you're sending a report back to essentially the clinician or the hospital, and they would then download those PDFs. So really at a basic level, it was around a database, and then giving people access or downloadable reports. And that's how I started off. And again, I got a company to help me build that, and then went through a few cycles. So initially I had the same company that did the software, but I had some issues that the actual data was not.
Oh, I always loved learning about the issues. So
Yeah.
First of all, how did you find the company to build the software to start with? Did you just put an advert out, or?
No. I mean, it's a real challenge, and really it's can be a little bit of a lottery if you don't have that expertise, internal expertise around how software works. And essentially what I learned from my first encounter with the education software was to produce a little specification pack. So I built a pack, and I would then send it out to maybe 20 companies to get quotes back. And then based upon those responses and the roughly where the cost was lying, I would then take it to the next step and then cut it back down to maybe 3 or 4, and then narrow it down to maybe the 1 or 2, and then go and speak to them at length. So we did that with the software. At that time, we identified a company in city centre, Manchester. It unfortunately didn't work out. I think probably the scope at the time was too broad, and there's a lot of scope creep on our side. And then eventually there was a lack of insight from the key developer on that side, and so we had to part our ways. And then I went back to the guy who did the education site for me, because we're now person you trust thing. He built something which we did see to its beta testing go live, but we had problems. There were too many bugs in the system, and I feel because he had his own CMS, there was issues related to that. Yeah, so the biggest problem was that the data fields were not holding the data consistently. So when you wrote a report, you would get the data from a different report appearing in that report. So obviously it makes it difficult, doesn't it, to have confidence in it.
Yeah, it's a bit like a you never quite know what you're going to get, which isn't really software, because it's meant to be repeatable. That's an interesting one. So that was the second attempt, was it?
Literally, yeah. It was a second attempt. The first one was a failure, but the first one failed also. We went through, life is always difficult, as you know. First one was, I think, the scope creep and lack of specification. Second one, we went through a period where we were hosting it, and then the site was deleted halfway through the project, and then there was no backups. You had to rebuild it. That cost a huge amount of money. I learned a lot from there. And then when it went live, it wasn't fit for purpose. And then we landed the client. And then what I did at that point was, through a contact, interestingly, I was introduced to an outsourced company based in Pakistan, and they took on the project. And it was really essentially, it was built out from there. Because we had the contract, we had to move quickly. We're talking about in a number of weeks, the product was built, ready to share with the customer. But again, as you know, I'm clinical pathology. I'm not IT. So maybe the criteria you would use, Rich, in terms of selecting, I wasn't completely aware of that. So I would look more at the end product, the UI, UX. Does it do what I need it to do? Does it look stable? Is it fairly secure? That kind of thing. And then we went with that company, and we continued for a number of years.
Oh, a number of years. Okay.
Yeah.
Okay. And so that, I think it's always a challenge when you're trying to get software built if you've never really lived through how can I say, a lot of hard problems that come up when you're actually trying to release it, because building something on the screen that looks like it works is a very long way away from production ready robust software that doesn't have serious issues in it. So it's it's difficult to get there, especially if you don't have that background. A bit like me trying to come into a pathology lab and run a pathology lab. I mean, I would have no idea what I'm doing. I could read about it.
No, I totally go with you, and I think we've been fortunate in many respects that we had through that initial endeavor being able to get a base product through that situation. And then what I've done is I've always, when I'm running a service, because obviously I was providing a service and the software, I was also constantly doing some upgrades. So there'll be new releases every month. I would do some feature requests, etc., on the software, but not spending anything too much. So that 2-year period, we built up a software which started off as a very basic database to something that was quite interactive and was kind of the software I would like to work with.
And leading in the market as well at that point, right?
Yeah, well, it was very different. Yeah, if you compared it to other systems, laboratory information management systems, you would find that the focus of those systems was on all of pathology. And, histopathology makes up a very small portion of this, and it's much more complex and much more niche market than, say, blood sciences or any other area of chemical, biochemistry, etc. So what would generally happen is the software is built for the wider market, so blood sciences, and then somebody say, oh, by the way, do you do histo? And histo is kind of bolted on. So this was a pure histopathology software. So the starting point was, what I wanted to see in a software. So, I wanted to be able to see a dashboard, for example, see all my cases. And I was working in systems, and I still do now. I work with the clinicists and telepath, etc., where I don't have that visibility. I can't immediately see all my workload, the cases, outstanding, etc., urgent cases, MDT cases, etc. And whilst it might sound quite fairly kind of basic and straightforward, it hasn't been thought through by a lot of the vendors. So it's nice for you to say, it's kind of, cutting edge, but it was only cutting edge because, as a pathologist, there was loads of frustrations. You were faced with these systems that you never really found out who was building them, yet they were not quite what was needed. And this allowed me to do that. So it allowed me to really kind of, clean canvas, start and kind of build and change and work with designers, work with BAs, etc., to make it into something quite substantial.
Yeah. So let's go back. So you ended up partnering with the firm in Pakistan, and they worked out to be really good, and you carried on with them for a couple of years. What's the story then?
Yeah, and then there was a kind of a point in the whole relationship where the owner at the time, who also worked in my pathology services, provide some support, was looking for a buyout. And at that point, I then acquisitioned the company. It then became mine. I then expanded from there. So from having a core team in Pakistan, I built up my team in India. And then I also started looking at potentially people from the UK to support it. So it really did take a different trajectory after that, because I was working purely with a third-party provider, but somebody had a good relationship, to something now that I owned. And was able to kind of work with an engineer and work through. And at that time, I did actually reach out to some advisors in the UK, and I had a couple of IT advisors that would help me direct the company. But, I had to work within budgets. I had to work within, the contracts coming in. So for me, a lot of the work in those stages was proof of concept, providing it for my own customers, not a pure SaaS model where I would be able to give it to somebody else. So that only started taking place, in the last few years. So for up to that time, it was always to support me and my services, me and my business, very similar to other companies, software that was there to deliver, reports back to clinicians.
Yeah,
and
you
back
weren't starting to actually you weren't starting to actually sell it into the market.
No, no. And I think in a sense, there was no aspiration, which is interesting because, you'd think with kind of business minded individuals that would always be something that one would consider. But there was no kind of overriding aspiration to do that.
Right.
It actually, it almost happened through really networking. And effectively, I had good relationships with people in the US, particularly pathologists that ran courses out there, and particularly one person out there based in New York, Raj Singh. He's really well known in the IT pathology world, asking me about software. He had opportunities in the US and he asked me if there was anything out there. And then I had a conversation with him and I did a bit of a show and tell of our software. Yeah. So that was really my first time where I demonstrated the software to others. And I kind of surprised myself because I didn't expect the feedback. So to me, it was like I'd got used to a software that I'd gradually built over time. It was good. It did the role that I needed and sufficed in dealing with some of the nuances to the service. But that was right. That's as far as I was taking it. And it was really opened my eyes when I showed it to Raj, and he said, "Oh, that's perfect software for the markets in the US." And he had particularly a customer there that he was wanting to share it with.
Because there wasn't anything else around like it.
Yeah, because they were facing the same scenario that you had big boys in there, which were the big companies that were providing almost bespoke software to large hospital, multiple kind of networked hospitals, but nothing for the smaller enterprise units, laboratories, etc., that want to kind of move into the market or are already in the market. And up to that point, really everybody that I knew had their own software. So all these laboratories had to build their own software. In my time, I realized that actually they would stop at that very kind of that first step that I did, which is generate the PDF and have a single data entry field. They kind of stopped there because it filled a purpose. Not many people then went to kind of, role-based permissions, looked at different, roles within a pathology department and how that impacts on the report, and then building out to how laboratory workflow occurs, how work is allocated, all those kind of things that people hadn't even thought about considering.
And you had?
I had, yeah.
And Raj saw it?
Yeah, and Raj is very keen. We actually tendered for Sloan Memorial at the time. It's going back a few years, but obviously we were not successful in that particular opportunity. And then really he had his own software, and that just kind of gave me the impetus to kind of start marketing mine in the UK and build my company up in the UK. And he went his own way, but still there is some communication between the two sides. Yeah. And what's interesting, he went down the IMS route, image management system route, and we've gone down the digital LIMS route. Mm-hmm. And even to today, his IMS part is the core business and not the LIMS, because the LIMS requires you to do a lot more to get the case flows and everything working.
Yeah, it's very complicated. As I understand it, it's very complicated, or can get to quite complicated workflow.
Yeah, the kind of core is really quite straightforward. The concept is quite straightforward. Specimens coming in, blah, blah, blah. But actually, when it comes to the detail and you have to order a test on a block or a slide, and, you've got to do a specific stain, you've got to do a review case, or you've got to do composite reports, that take molecular, take histology, take microbiology. Then suddenly it needs a much more interactive, much more intuitive system to be able to offer that. And even now we with what I've got and built through yourself, we're not completely there. There's so much more that can be done to ease the workflow and efficiency of a department, but also the role of a pathologist as well.
So that's really interesting. What's the current situation now? You've got it delivered in. Hospitals are buying, and health services are buying this and licensing it from you.
Yeah. So, I mean, we are very much at the kind of the early stages of our journey. We've definitely made penetration into the market. We have a good portfolio now. So we've got a small laboratory, which has a single pathologist. Then we have, which we license to and have gone live with. We've got a medium-sized laboratory that has, maybe 5 to 10. And we're going through a UAT process there. And then we've got a multi-hospital kind of enterprise type client who's using it in their laboratory as well. So we've kind of covered, different segments or different target groups in the market. And we've demonstrated actually we can provide something for the small laboratory, but also we can take on the bigger, the more challenging, multi-site hospitals, which require, a lot more integrated services and software.
And what's the differentiation? People have got other choices, especially on the enterprise side, but I'm assuming that the way that you built it gives them an advantage.
Yeah, I mean, in some ways, it's understanding where the current market is. So the market in pathology, going back maybe 2-3 decades, has always been around laboratory information management systems, something that can track a case from receipt into the laboratory throughout the process and provide a pathology report back to the EPR or the patient electronic management systems back into there. So the LIMS systems have been running for decades. In the last 10 years, probably last 5 years, digital pathology has now made a major impact on the market. But the LIMS companies have kept to their core business and kept to information management. And you've now created a new group of companies have come through, not related to LIMS, that are doing digital pathology. And it's all around image management. And what's interesting is that the image management companies have actually come a little bit more from radiology into pathology, because radiology went digital, a decade or two ago. So they were ahead of the game. So you've got the two groups that are providing something for pathology. Nobody was providing both elements. And that's where PathHub, that's where my company, my inspiration came through. So we were also LIMS, and probably about 3 years ago, we developed our own viewer, and that changed our whole trajectory. So we had the base product that allowed images to be, specimens to be handled, and then we got the IMS system built into that. So that is very unique in the market. Even today, even my own department would have a separate operating LIMS, and then you'd log in separately to IMS, and it'll be a very basic but functional viewer with case flow management kind of centered around the images rather than centered around the case. And that's how they've been built, and that's how they are in the market. So we do stand ground because we have produced something unique, and people are now starting to catch on to that concept.
Yeah. So previously, everything was kind of separate. You had to have 2 different logins. You have to switch between screens.
Yep. And there's a governance issue there, because, you would log into, currently this is what happens. You log into the LIMS system, bring up the patient, then you log in separately to the IMS system, bring up the image. And generally there is a unique ID that would then generate the image, but you could inadvertently put the wrong number in. So again, there are kind of clinical governance issues that can arise through that methodology. So what our system does, it takes care of that clinical risk by a single system that you don't have to log in again, that pairs the images directly with the case. And that's the big attraction for our type of software.
Yeah. So everyone can be sure that the image that they're looking at is actually of the patient that they're reviewing the notes for, and these things absolutely match up.
Yep, and also, it's, that's just that's the crux. But then efficiency savings, because you're not logging into two systems, learning about two different technologies, etc. So from the basis, it just really, lends itself to really being a very smart way to move forward. And really, in today's world, as a pathologist, I should be able to have that. I should be able to have my images within my limb system, and I should be able to see them side by side.
And that comes down to, as well, just being quicker. And we all know that, bless the NHS, it has there's a lot of people waiting for things. And actually, the quicker you can get through these cases with the same, obviously, bearing in mind the same level of accuracy, but if you can cut down the stupid stuff, like extra button clicks or extra screens, or and people can just get on with the job that they need to get on with, then that actually makes a difference, because those 30 seconds, those 15 seconds that you can get things done quicker suddenly add up over a year.
Oh, totally. I mean, you say a year, but actually, you'll see the immediate impact even over a week. So say if a pathologist is reporting 100 cases a week, and as you say, an extra minute on each case because of inefficiencies is nearly 2 hours of work. And that would be 2 hours taken out of your job plan, an NHS job plan, half a morning. It can really build up. And if you then multiply that, it's massive savings. So in some ways, there's a cost attached to any software, but the return of investment to the NHS and to delivery of services and reports back to patients and cutting down cancer wait times, you can't put a value on that. And I think that's more the driver for me, is getting good quality software which will help patients at the end of the day get results more with the same level of accuracy in a better workflow through a better, more seamless software technologies as well.
I mean, I don't want to sound dramatic, but it saves lives, right?
Absolutely. And anybody who's had somebody go through the healthcare system, you'll know that the core of histopathology is around cancer diagnosis. Mm-hmm. So once that cancer diagnosis is made, that report goes out, then all the, whether it's surgery, oncology, radiology or radiotherapy, all of that kicks off after the diagnosis. So there's this big multidisciplinary meeting that takes place on a regular basis, and those reports kind of critical in making those kind of clinical decisions and pathways for the patient. So absolutely saves lives. So if you can, and they only happen once a week. So, a lot of these, you miss the meeting that week, it gets pushed, therefore treatments get delayed by a week. That's how the system works. So if you can provide efficiency, and whether that is remote reporting from home so the results can come out, or the things we've talked about, absolutely, there's a massive impact on patient care. And I'd say that's the core, but also good software allows data to be pulled. So data analysis around cancer, incident figures, etc. All of that data can be pulled out of systems that are well built. And then you can put that into studies or provide those to service providers to understand trends in cancer treatment and also cancer progression.
It's very important to get those pieces right and to get them working as fast as possible to make the whole system as efficient as possible, especially with that, data as well drives decisions for the business of the NHS to help them, put their money in the right place at the end of the day. So yeah, excellent.
Absolutely.
Excellent stuff. I suppose just, kind of getting to the end of our talk, but some lessons. What would you, if you were building software again, what would you do differently?
Yeah,
if
I
you're
think
making that
really,
leap. If you're someone who's listening to this, so people might be listening to this, that they've got a business, they've got something that they are, an idea to complement their existing business to create a new service line or.
Absolutely. For me, I think, and one of the biggest kind of major changes to the way we've been operating was to go into partnerships with companies that actually know how to build software. So I had taken a bigger leap in acquisitioning software, and sometimes with acquisitions you have the right people within the acquisition that can lead it, and often that full skill set isn't there. So you get good developers, but do you have a well-functioning team? Do you have somebody who's got vision and foresight? And I think with a hybrid model, with somebody who's got like years of expertise in IT, and then working with somebody of my kind of pathology hat on and the pathology side, that is a perfect arrangement. So I would strongly advise anybody interested in going into software is don't do it on your own. Get the right people involved, and really you will find really good developers, but they're just good at that aspect of it. You do need somebody who's got that CTO type role that knows how to run a company well, organize teams, be able to help you understand requirements and understand the capabilities of software as well. And I think for us, that's the biggest advice we would give. Don't go alone. Create a hybrid. Get somebody to get that software built for you, and then work with them. And for us, it's an ongoing partnership. We're in a strong position, as we've said, with our clients, but we've got the support of experts in that particular field, and it's not just experts who on the ground, but it's people who are actually attending conferences, going to IT conventions, and coming back with the latest technology, whether it's AI sorcery or whether it's whatever it may be in terms of what's out there in the market, microservices, etc. Bringing that and say, okay, look, why don't we apply that? And I think that kind of area, because people who are coming and looking for software will have a great idea, but the engine behind the drivers of that software, that level of knowledge, we could never attain if you're not from that specialism. So I think having the right people, the right team, it is quite a science. It really needs the right configuration to make it successful. It doesn't just happen on its own.
I often think that the industry tries to make it look really easy. So there's, everyone's built a spreadsheet, spreadsheets aren't that hard. And what's really a database? It's kind of like a spreadsheet. And then you get up to the next bit of like, oh, there's a low code platform. I can go and build a website in 15 minutes. Yeah. Now with AI will just build it. But actually, all of these things to me are kind of the equivalent of a home pathology kit. You don't see those getting sold, do you? You don't see.
No.
I mean,
build your own microscope kind of thing. You don't see that, no.
And it'll work for a bit, and it might work in a specific way, but it's not going to be robust. It's not going to be scalable. It's not going to be software that you can then take and grow in a way that maintains the robustness that you need when you're running a business. Because at the end of the day, you can't have systems that when you open a page, it's got a field in it, but you don't quite know whether it's going to have that right data in the data that you thought it had in it.
Yeah, and I think like you say, it's fine from an information website or something very basic to kind of look at the tools that are out there. But if you want an application, something that can serve a specific purpose, then you really do need to get the right people involved. And I think at the center of this is security, resilience, reliability, scalability, all those things, because our market, as as I've described to you, it's a huge market. Healthcare is cutting edge market. It needs to have good quality software. So it's worth putting the investment in. And, we are excited in that sense, working with yourself and building software like this. It's exciting for us because we feel now we've got a good base product that we can scale upon. And we've got those unit tests, we've got those automated tests, we've got the Scrum boards and the Jira boards, etc. set out. So there's a framework for releases and a process that we're now following. It's been a challenging time to get to that point, to learn that as we've got along. And really, did I need to learn it? No, I needed to get the right people involved that knew about it and could take us along that journey. And I think that's the take-home message here. Like get the right people involved, people who know the science, and I can provide then the knowledge base of my industry, and that's my strength. You're
the expert.
I know. I know what I want. And then it's people like yourself that will make that into a realization. But as you say, there's a lot of charlatans out there. There's a lot of companies that can do it for cheap, can do it, can make it look good. We had a site that looked really good, yet the engineering behind it was highly questionable. So getting the right persons involved and putting the right money will really stand you in a good place.
Yeah, great. Well, Iskander, it's been fantastic talking to you. Thank you so much.
I've enjoyed it. Thank you.
Thank you so much for your time. And we wish you and PathHub all the success. And just get it sold into the NHS and let's get these waiting times down. That's what I'd say.
Absolutely agree.
All right. Thank you very much.
All right. Thank you, Rich. Cheers.
Thank you for listening to this episode of Software Meets Business, the podcast sponsored by Head Channel. If you enjoyed this episode, please leave a rating and review on your preferred platform.